Hello, Lady Gaga. I'm Dr. David Bilstrom, and this is an open letter to you regarding your positive ANA. I'm a medical doctor who specializes in reversing and preventing all autoimmune disease with the goal of revolutionizing the way autoimmune disease is cared for worldwide. Now, historically, a positive ANA has not been considered an autoimmune disease, but it truly is by definition because an anti-nuclear antibody is antibodies being produced by a confused immune system attacking a person's and your own nuclear material, your own DNA. Rule of thumb is you never want to piss off your own DNA because the DNA tells the cells what to do in every cell in your body. Now, historically also, because ANA has not been considered a formal autoimmune disease, people with an ANA are already not feeling well. They're told, well, just wait. We're just going to wait. We're just going to watch. Maybe we'll give you a medicine to take care of fibromyalgia, because that's so common when these autoimmune processes start, muscle pain of more than 3 months duration, or a lot of other health issues. But unfortunately, when people, usually women, because 80% of people that get autoimmune disease are women, are told to wait because you're not taking care of the reason why your body started attacking your nuclear material already, that process just keeps churning forward. And this is where, when you have a positive ANA, the science is very clear, is that you have a profound increased risk of lupus, of rheumatoid arthritis, of Sjogren's disease, mixed connective tissue disease, autoimmune disease of the thyroid. Now, why wait until something gets worse? But unfortunately, Western allopathic medicine, we're not the greatest yet at preventing disease from coming. When it comes full blown, we have medicines that we can tend to use to put a bandage on a few symptoms, such as women with a positive ANA that are told to wait 3, 4, 5, 6 years later. They just keep getting worse and worse. New things come. All of a sudden, because you haven't addressed why the first part of the DNA was attacked, now you start attacking new parts of the DNA. And then a person's told, oh, now you do have lupus. Now you do have rheumatoid arthritis. Now you do have these other autoimmune diseases. These things run in families, of course. Thus, when I heard that you have a positive ANA, but it's not an autoimmune disease, I was already concerned. But also when I hear that, well, it's not lupus like your aunt has, it's just a positive ANA. Well, a positive ANA means you are motoring towards what your aunt has, or rheumatoid arthritis or other autoimmune disease. Now, in medical school, we are not taught where autoimmune disease comes from. We are not taught how to make it go away. We are taught how to use medications to control a few symptoms of the issue, but because you're not addressing the problem, even by using medicines to control the symptoms, whether it's the fibromyalgia before the rheumatoid or lupus, or when you get the lupus or rheumatoid, the other medicines, you're still not fixing it, and things just keep progressing along. Now, fortunately, there's enough practitioners that know of what we're doing to revolutionize the way autoimmune disease is dealt with, that we do get referrals from medical professionals for people that have a positive ANA, because they realize we know where this person is going if we don't reverse the process. And we can reverse the process. We can make the ANA go negative. You stop attacking that part of your DNA. We have done our due diligence to make sure somebody never moves forward to lupus, rheumatoid arthritis, other ones, including we have a lot of patients that have done their homework. They've looked at the internet, amazing detectives they are, that they come to us and they say, I have an ANA that's positive. I don't want it to progress to lupus and other autoimmune disease. And we help them reverse it. We prevent all of the future autoimmune diseases. And it's very satisfying. Now, even though this may seem like a unique situation, it is so common. Not only is it estimated that 50 million American women have an autoimmune disease that's already widely identified as, of course, being an autoimmune disease, but there are 30 million women in the US alone with a positive ANA who have not started to attack other parts of their DNA yet, who are in the exact same situation you are. But this is why I felt it was so important that I name a positive ANA, identify it for what it is, which is an autoimmune disease, and it's called Bilstrom's nuclearitis. And I named it in 2018. It was first published in a textbook on pain management in 2020, because without a name, Western allopathic medicine, we don't know what to do. If we can put a name on something, well, maybe here's a bandage medicine, but we do not know what to do if it don't have a name. So I felt like it was important that a name was established, but instead of using the medications that typically get used that will increase your risk of cancer, person with an autoimmune disease process already has a profound increased risk of cancer, because cancer is the flip side of the same coin, this autoimmune disease. These medicines also will increase your risk of getting a life-threatening infection that no amount of antibiotics can treat. And as weird as it seems, these autoimmune disease medicines can actually give you as a side effect a new autoimmune disease. So this is why I felt it was so important to give a name to a positive ANA, which is obviously an autoimmune disease, but unnamed, and I named it Bilstrom's nuclearitis, because we just can't let it get worse and worse and worse until it drives other autoimmune disease processes. It was important that we address it right away before it got worse. And the body is so smart, it really does not take a lot to reverse chronic disease and autoimmune disease. The science is very clear of what causes it, such things like vitamin deficiencies, hormone imbalances and deficiencies, chronic infections, not the infections that drive obvious infections. It's the kind of infections that drive sneaky chronic disease. The stress hormone cortisol thrown off, environmental toxicity, and gut. And the gut is the real big central mechanism for all this stuff. And so whether somebody is a superstar or a single mom, these are things that anybody can incorporate to reverse this process long before it gets worse. So now that we have a name for a positive ANA, we now have protocols on how to address this and make it go away, reverse the entire process. And this comes from 20 years of experience doing this for people, both adults and children. You'd be amazed at how many children have autoimmune disease nowadays, including so many young children with juvenile rheumatoid arthritis. We have protocols that allow us to reverse the process. We do not need to rely only on the medicines that suppress the immune system, the immunosuppressants, which have some profound side effects, such as increasing cancer risk, such as increasing risk of an infection that no amount of antibiotics can treat, and as a side effect can actually give you a new autoimmune disease. Even though this seems like it might be a unique situation, it really truly isn't. There's 30 million women in the US alone with a positive ANA, and they haven't started attacking other parts of the DNA yet. So there are 30 million women out there alone who really need to know this information. We could change the way women's healthcare is dealt with and change the lives of so many millions of women, including, because cancer is the flip side of the same coin as autoimmune disease, we know that one particular hormone imbalance called estrogen dominance is profoundly impactful when it comes to driving autoimmune disease. One reason why 80% of people that get autoimmune disease are women. So this estrogen dominance not only drives all the hormonal menstrual issues that women have to deal with, such as bad flows, bad cramps, PMS, ovarian cysts, breast cysts, fibroids, endometriosis, but because estrogen revs and progesterone calms, it drives women to develop excessive worry, anxiety, panic attacks. Insomnia is so common, but we also know this estrogen dominance that's trying to drive autoimmune disease also drives cancer, such that when a woman has estrogen dominance before menopause, oftentimes showing up as those hormonal menstrual things or the cognitive emotional things, they have a 5.4 times greater risk of getting breast cancer before menopause. Not twice the risk of breast cancer, not 3 times, 5.4 times greater risk, and a 10 times greater risk of malignant cancers their entire life. This is so important to get at before it gets worse and not only prevent autoimmune disease, but cancer as well. We can improve women's healthcare so profoundly. Now, I love working with other practitioners and teaching this information because this is not something that we get in medical school or in residency. We learn about the medications to treat the symptoms, but not why this happens and not how to make it go away. Now, the body is so smart. It knows how to fix this. It is trying to fix it by doing things such as optimizing vitamin D levels, fixing the estrogen dominance, healing the gut, including a profound central mechanism, which is the vitamin D receptors in the gut become resistant to vitamin D, so that even if you have all the vitamin D in the world, you can't get the bang for your effort. We fix that. That can totally reverse the autoimmune process by healing the gut. We allow the body to find calm through regular relaxation activities, but also as locked cortisol, the stress hormone, into stress mode, the stress hormone resets into the calm mode. Women are calmer. They don't get panic attacks. They sleep like a baby. They get rid of all the hormonal menstrual issues, the cognitive emotional issues. But then as cortisol resets, now the body's in a position to fix anything that's going on already, but also put them in a great position to stay healthy the rest of their lives. If I can help your practitioners help you, or if I can help you directly, or even better, perhaps we do both and we change the way women's healthcare is dealt with in the entire country, the entire world, it would be my pleasure.